disease. Organs that filter waste products from the blood. They also regulate blood pressure, electrolyte balance, and red blood cell production in the body. The kidneys get their blood supply from the renal arteries, directly from the aorta, and send blood back to the heart via the renal veins to the vena cava. When blood goes to the kidneys, sensors within specialized kidney cells regulate how much water to excrete as urine, along with what concentration of electrolytes. If a person is sick and dehydrated, the kidneys will hold as much water as they can and urine will be very concentrated. Healthy kidneys keep a balance of water and minerals, remove waste from your blood after digestion, muscle activity and exposure to chemicals or medication, make renin, which the body uses to help manage blood pressure, makes a chemical called erythropoietin, which prompts your body to make red blood cells, and makes an active form of vitamin D, which is needed for bone health and other things. Chronic kidney disease or chronic kidney failure describes the gradual loss of kidney function. When chronic kidney disease reaches an advanced stage, dangerous levels of fluids, electrolytes, and waste can build up in your body. In the early stages of chronic kidney disease, a person might have few signs or symptoms. Then there are people who don't have any symptoms until kidney function is very impaired. Chronic kidney disease can progress to end-stage kidney failure or end-stage kidney disease. This is fatal without artificial filtering or dialysis or a kidney transplant. Signs and symptoms of kidney disease are often nonspecific. Some symptoms include nausea, vomiting, loss of appetite, fatigue and weakness, sleep problems, changes in how much you urinate, decreased mental sharpness, muscle twitches and cramps, swelling of the feet and ankles, persistent itching, chest pain if fluid builds up in the lining of the heart, shortness of breath if the fluid builds up in the lungs, and hypertension that is difficult to control. If a person has a medical condition that increases their risk of kidney disease, chances are doctors will monitor your blood pressure and kidney function with urine and blood tests. There are other tests that might be done depending on what stage a person is in. Chronic kidney disease happens when a disease or condition impairs kidney function, causing kidney damage to get worse. Diseases and conditions that could make kidney disease worse or could be part of the reason why kidney disease happens are type 1 or type 2 diabetes, high blood pressure, glomerulonephritis, interstitial nephritis, polycystic kidney disease, prolonged destruction of the urinary tract. This could be from an enlarged prostate, kidney stones, and certain cancers. Vasculourethral reflux, when your urine goes back to your kidneys. I have this in one of my kidneys. I have one kidney removed because my reflux was grade 4-5, and my reflux in my left side is grade 3, which caused recurrent kidney infections or polynephritis. There are many complications related to kidney disease. Some could be fluid retention, a sudden rise in potassium levels in the blood, heart and blood vessel disease, weak bones and increased risk of bone fractures, anemia, decreased sex drive like erectile dysfunction or fertility issues, damage to the central nervous system, decreased immune response making the person more vulnerable to infections, pericarditis, pregnancy complications, and irreversible damage to your kidneys. If one kidney fails or is diseased, it can be removed and the remaining kidney may continue to have normal kidney function. A person can live with one kidney as long as the kidney is functioning normally. If kidneys fail completely, the only treatment is dialysis or a transplant. To be on the transplant list, it is very long. So if you have a member of your family that could transplant a kidney, it is more likely to do that than go on the list because the list is very long. Pre-renal causes are due to decreased blood supply to the kidney. This could include hypervolemia because of blood, dehydration from loss of body fluids, poor intake of fluids, medications, and abnormal blood flow to and from the kidney because of obstruction of the renal artery or vein. In order for a condition to be known as a public health issue, it has to meet 4 criteria. It must be a large burden on society. The burden must be distributed unfairly. There has to be evidence that upstream preventative strategies could possibly reduce the burden of the condition, and what preventative strategies are not in place yet. Kidney failure can happen from an acute situation that injures the kidneys or from chronic diseases that gradually cause the kidneys to stop functioning. Acute kidney failure causes could be sepsis, medications, rhabdomyolysis, I probably said that wrong, so I'm sorry, multimyeloma, hemolytic uremic syndrome. Post-renal kidney failure is due to factors that affect the outflow of the urine, like obstruction of the bladder or ureters, prostatic hypertrophy, or prostate cancer, tumor, or kidney stones. Kidney stones usually affect one kidney, so it is not the main cause of kidney disease. The most common causes of chronic renal failure are poorly controlled diabetes, high blood pressure, and chronic glomerulonephritis. The least common causes are polycystic kidney disease, reflux nephropathy, nephritic syndrome, Albert's disease, interstitial nephritis, kidney stones, and prostate disease. If not treated, kidney failure can develop into life-threatening circumstances like lethargy, weakness, shortness of breath, edema, weakness because of anemia, loss of appetite, fatigue, congestive heart failure, metabolic acidosis, high blood pressure, fatal heart rhythm disturbance, uremia, which can lead to the brain encephalopathy, and pericarditis or a low calcium blood levels. A person can live A person can live with one kidney as long as the other kidney is functioning normally. There are increased risks if a person has kidney disease. It increases a person's chances of having a stroke, heart attack, congestive heart failure, high blood pressure, fluid retention, anemia. A sudden high blood pressure can both be a cause and a result of kidney disease. High blood pressure damages your kidneys, and damaged kidneys can't work as well to control your blood pressure. Kidney disease usually gets worse over time and can lead to kidney failure. The sooner a person finds out they have kidney disease, the sooner they can make important changes to protect their kidneys. Chronic kidney disease is common in adults in the United States. More than 30 million American adults have chronic kidney disease. People who are more likely to develop chronic kidney disease are people who have diabetes, high blood pressure, heart disease, and a family history of kidney failure. Diabetes is the leading cause of chronic kidney disease. Your chances of having kidney disease increase with age. End-stage renal disease is a form of chronic kidney disease that life can be extended only by dialysis or transplantation. There are more than 385,000 people in the United States with end-stage renal disease. The numbers increase every year. Yearly death rates of end-stage renal disease patients are 20%, and chronic kidney disease patients have a risk of cardiovascular disease that is 10 to 30 times that of people without kidney disease. Here are my references.